I'm not knows everybody.
It's a very pretty campus. Very nice. It's very thoughtful.
Okay. For me?
Also do downlights here. Yeah. And the backlights, front of backlights is not those, but the back. Yeah.
It's okay?
And yeah, that's good. Now we have lights here. But not in the front.
I don't really know anybody. Oh, okay, that's good. And you went to graduate school, so I don't know. I mean, are they potential? Yeah. I think there's a difference that we live at, right? And they're at versus like using different grades.
Oh, that's the graduate program that you said.
We live at graduate school. So,
The old priest at my church, I did graduate from Yale, not gonna do any distinction in school.
that's just how I feel like when we put like we put it's just that one. So we're leaders.
Like, I'm like George W.
Right. My thinking is I think which under there are phenomenal.
Pictures, one couple of minutes time.
One more minute.
One more minute?
One more for business school. That's a little fast.
I'm sorry?
You can introduce you, or you want to just go?
No, you can introduce me.
I can't?
Yeah, sure.
Okay.
Absolutely.
All right. All set?
Yeah, right.
I'd like to welcome all of you here today to the special presentation being given by Dr. Muriel Harris on building sustainable community partnerships. By way of background, Dr. Harris is a faculty member here at the school, part of the Department of Health Promotion and Behavioral Sciences, and I can give you a bit more background here. It went away. There we go. Thank you so much. By way of background, Dr. Harris is a teacher PhD in public health and health promotion at the University of South Carolina, Columbia, and has extensive international work background as well, having worked at the Kwame Nkrumah as
University of Science and Technology.
University of Science and Technology as a Fulbright Fellow and scholar there. And her passion for public health has led her to travel internationally in many different areas, including Switzerland, Ghana, Sierra Leone, Haiti, and South Africa. So she's quite expert in this concept of building communities for the purpose of doing research projects, education, and other service projects. So thank you very much to Dr. Harris.
Thank you very much, Dr. McKinney. And good afternoon, everybody. And thank you all for coming. I want to talk today about building sustainable community partnerships. That's who I am, as you've already heard. The objectives of this session will be for you to learn ways to approach communities, be able to develop relationships, build trust, and foster lasting relationships with communities, and learn strategies to strengthen existing community partnerships in support of research, education, and service. The topics I'll cover are basically those definitions that we'll use, community engagement continuum, community engagement itself, community entry, developing relationships, building trust with community, and fostering lasting relationships with community. Community partnership model for action, achieving community action goals, and strengthening that partnership. So let's start off by defining community. Community can be defined in many different ways. It can be defined by common interest, common characteristics of the population, common professional interests. So in this room, we might say that we belong to a community of individuals with an interest in public health. Community may also be defined by a common history, social, economic, and political interests. May be defined those under a common policy or a common location. So all those in Louisville will be considered Louisvillians. Those in West Louisville will be considered West Louisvillians, and so on. So what is community engagement? We define community, but what is the engagement of community? So the engagement of community is a process for working collaboratively with and through groups of people affiliated by geographical proximity, special interest, or similar situations to address issues affecting the well-being of those people. So communities come together to do good. Communities come together to achieve an outcome, as you can see in the other definition, applying a collective vision for the benefit of community, to improve the health of community and its members, to serve as a catalyst for changing policies, programs, and practices. So community engagement is many, many different things, but it's really defined by an outcome, the benefit to the community in coming together and doing that work. So the engagement of, or the community engagement continuum starts out with outreach. So we start out with outreach, and basically all you're doing there is telling people something, right? We go out and we do outreach, we inform, we talk about whatever it is we want to talk about, HIV, diabetes, Hep C, whatever it is, we talk, we present information, and the outcomes are ultimately really just channels and channels for outreach, channels of communication. The next level up is consultation, or consulting with the community. And then there's some amount of sharing, there's some amount of exchange of information. But when you get into involving community, you definitely have a higher level of engagement. And at that level, you expect to involve more participants, more participation with the community on their issues. But it's not necessarily them doing a lot of that work. It increases the visibility of the partnership, and it establishes increased cooperation. So you're still not at the point where you're going to be able to achieve any really goals, any action goals. And then there's a level of collaboration. Collaboration level, you are beginning to get a bi-directional communication channel. You're building a relationship with the community, you're building trust. The highest level of community engagement is when there's a shared leadership. When you, as the outsider, gives something to the community, and the community gives something back. There's an exchange. There's much more of a relationship between the two parties, and the outcomes you expect are broader health outcomes affecting the broader community. Right? So you go from outreach to shared leadership as your continuum of community partnerships. Before we can get into community, before we can do anything, before we can really be effective, we really need to enter the community. And we can say that's formal or informal. It's generally more informal, I would say, in the US, and what you may have experienced in most of your career, because we tend not to do the more formal engagement of the leadership of the community. We tend to go to community-based organizations, so we go to individuals that we know, and we build our our collaboration from there. However, it's important that you meet the potential partners, but especially community leaders. If you want to come into Louisville, for instance, to do something from outside, you may try and identify the political structures. Who is the mayor, for instance, if you're working at that level? Who are the community leaders if you're working within a neighborhood, for instance? So local, regional, national, or international leaders and policymakers and other stakeholders are important potential partners who need to be met at the door. So introduce yourself. In some cultures, you have to be introduced. You can't necessarily walk into a community and say, I am so-and-so. You go into a community with somebody and you're introduced to the individuals as somebody from the outside. So everybody knows who you are. You give your background. Who are you? What are you doing? Why are you here? Refer to people that you know or they know especially, because that increases credibility. And provide a reason for your meeting. Why are you here? What exactly are you about? What exactly do you intend to achieve? How do you intend to achieve it? Who do you intend to work with? But also learn about the community's perceptions about your organization, about yourself. I share this story often, and my students will tell you that they've heard it before. But one of the things I did when I came into Louisville early on is I went to a couple of meetings with the Signature Partnership folks. And it was a Saturday morning, and they'd done all the presentation. It was just when Signature Partnership was moving into the community. They were already established that there were partners between U of L and various entities within the community. But they wanted to have a more formal engagement with the community. So I went to this community meeting and I joined them. And at the end of the meeting, somebody said, but you've been doing this work for a while. But there are only a couple of people that the University of Louisville engages, and they go to all the meetings, and they don't bring anything back. We don't know what they're doing. We don't know. As far as we're concerned, they don't represent us. So it's important for us to understand what the perceptions are that the community has of us. And most universities will tell you that there are perceptions out there, and we need to understand what they are if we're going to be able to do good work in the long run. Be conversational. This is not a survey, it's not an interview of any kind. You're trying to build trust. You're trying to develop a relationship with members of the community that you're going to be working with. And this is the starting point, right? Use communication listening skills to increase and build trust. Use a translator where necessary. Dr. McKinney mentioned that I do international work. And we do need to use translators often when we go into communities. And sometimes in very traditional communities, as I've worked in, and I took students to last year, when you go into the community, particularly with the chiefs and the elders, you don't talk directly to the community. You don't talk directly to the chief. You talk to the chief through his translator. Whether he can speak English or not is irrelevant. You do not speak directly. You speak to the translator, and the translator speaks to the chief. Right, and the chief speaks that way. Comes back.
Can I ask a question?
Of course.
So why is that if he or she understands the English, why you have to do that?
I said traditional, right?
Oh, okay.
So traditional societies,
Okay.
and this is the way you relate to traditional society. I will say though that when we went to Ghana a few years ago, we did a couple of times, and the chief got to know us, a couple of visits. And the second time, he speaks English, he trained in Germany. And he said, "Oh, please come back to my office. I need to talk to you." So we all went to his house, in his home. He had a home office, and we went there. We would just relax and sit and casually have this conversation. But that introduction needs to be made, and the leader needs to invite you into their home. You can't just communicate directly with them. When possible, propose projects that build on prior relationships. Because again, that builds credibility for you, for your work, particularly that work was well done. So this is Ghana. I went to Ghana last year. I just thought I'd share a couple of pictures, not many. And this is where we went to meet the chief. That's the chief, and we went to meet her in her home to tell her we were in Ghana, we were in her community in Anyem, in Obase, in the Ashanti Chieftain, and we were going to tell her that we were there. Interestingly enough, he was our translator, as it were, from KUST, Kwame Nkrumah University of Science and Technology. And he had not heard of this. So I said to him on the way there, can we go and meet the chief? And he went, really? What do you want me to the chief for? And I explained to him that, as visitors to his community or that community, we needed to go and meet the chief. And then he had to make multiple phone calls to get us to somebody from the community who would then take us and introduce us to the chief. And these are her, so she brings together her leaders, and this is us explaining what we're doing. And you can see we're very welcome to this community. She hugged every one of us at the end of that meeting. So, we'd already built that trust through the conversation with her. And we knew that we were then able to move in and do whatever we wanted to do in the community. So beyond entering the community and getting that blessing from the leaders, you must build the relationship. Build a relationship over time. It takes time to build good relationships, but you have to be humble. Be open to new ideas and be open to learning. It's very important we're open to learning when we go into new communities because there are a lot of things that we don't know. We don't know about that community. We may have a lot of information ourselves, we might have our expertise, but we don't know anything about that community. And it's important that we learn and we listen. Show an interest in building the partnership rather than just delivering a service. So if we're going to do research, we're going to deliver a service, we're going to provide children with immunizations, irrespective of what it is, it's important that we show an interest in that work, an interest in building the partnership rather than just delivering the service. And be clear about the purposes or goals of the partnership. Identify the community's needs. The community's needs may be different from ones that we identified. There's a story from years ago that very well-meaning individuals went to the community and had their own agenda. There was something that they wanted to do. There's something they thought the community needed desperately. And the community said, no, actually, we want a football pitch for our kids. And that's really what we want. We're not interested in what you have to say. And that's a reality. We often go into communities assuming that people want what we have to offer. It's not always true. It often is not true. So we have to listen. We have to identify what those communities' needs are. And to the extent that they align with our goals, that's fine. If they don't, we have to make a decision. Do we need to stay in that community and do what they want us to do, or do we step back? Maybe ask somebody else to go in and build a football pitch. But certainly, if we offer something to the community that they don't want, they're not going to use it. And that's been demonstrated here many times over the years. We must respect what the community does, the work that the community does, learn about the community culture, economic conditions, social networks, political and power structures. One of the things we need to understand is there are things that are said and not said in communities. And we have to listen very carefully. We have to ask questions. We have to try to understand, using our best techniques, what those cultures are, what the culture is, what the social networks are. Who are the people who connect with each other? Demographic trends, how things change over time in the community. What's the community's history? What are they resentful of? What do they enjoy doing? The experience of working with outside groups. Some communities have very long histories of how they've been disenfranchised. We definitely do not want to reinvent that wheel. Have a positive attitude and show enthusiasm for the work. The next step is actually building trust. So we've entered, we're beginning to build a relationship, but there's another step which is actually building trust. We can build a relationship and be able to talk to somebody and come to that individual and have a conversation and walk away. We may not have built that trust yet. The trust of that individual that knows that we can be trusted to do what we said we're going to do. To meet the goals that we said we're going to meet. To be respectful to the community. To learn with the community. So we need to acknowledge the history of the community when you know it and when we don't. We have to be willing to do something for nothing. We don't always get a return for our investment. We have to build capacity to translate research and technical areas of expertise to the community members. Oftentimes we go into communities and communities have the foggiest idea what we're trying to do. And it may be research. Education is a little bit more understood. But when we're going to do research, or we say we're going to do quantitative research, we're going to do surveys and qualitative research, we're going to collect data, we're going to do focus groups, photo voice, community. This is all foreign. These are foreign words and foreign language to many members of the community. And it's our responsibility to translate that technical know-how and those research methodologies into language that the community will understand. We have to get to know the community members. We have to share resources, information, offer consultation opportunities, funding information, knowledge, skills. Spend time with the community at social events so they know that we're more than just doing our research or delivering a service. Right? Let's attend their bar mitzvahs. Right? Let's go to their weddings. Let's go to their parties. Let's eat their food. Let's share in social events of the community as well. That's when they know that we care about them and not just about the work. Yeah. Right. So community partnerships may involve formal community organizations or informal community networks, and are based on trust, they're based on reciprocity, and they're based on a shared vision for action within the community. May be formed as a community advisory group. Quite often when we do research, we develop or we create a community advisory board, which we expect will be our voice of the community. But I'll caution you and say that oftentimes our community advisory boards are not well constituted. They don't represent the community in ways that we should have the community represented in the work that we do. Oftentimes we don't recognize who the major stakeholders are in the community. And then when we do, we bring in one person from that community. And unfortunately, one person in the midst of academics doesn't really have a voice. And therefore, they feel as if whatever they have to contribute is not valued. So it's important to think of more than just one person who comes to the table in order to participate in that community advisory board if you're going to form one. And community advisory boards provide the cultural context and the relevance for the work, and they translate that relevance back to the community. If we're going to collect data, for instance, it's important that the community advisory board understands the data, understands why we're collecting it, what we're collecting it for, and is able to translate that to the community in ways that the community can be supportive and participatory in the process. So this would be the model of action. Build trust, build relationships with community members, to form a community partnership which will lead to collective action for research, education, and more service. So let's talk about each one of those specifically, just for a minute. In achieving community action through research, education, or service goals. We'll go back to our continuum. And I want to reiterate the fact that you can't really achieve this work without shared leadership. Where you have strong bi-directional relationships, the final decision making is at the community level. Entities have formed strong partnership structures, and the outcomes include broader health outcomes that affect larger sorts of the community. In thinking about what the community will likely achieve or what could be achieved by the work that we do, within research we might ask some of the following questions. What are the perceptions of the population and the stakeholders of the problem? It's not our problem. It's got to be their problem. Right? What problem do they have that we can identify, that we can address, that we can provide data for, that will help them to take action? Is the priority of the community? I was in a meeting yesterday and we were talking about our work in Haiti, and somebody said to us as a group, whose priority is it? Is it your priority, as meaning us, the US, or is it the priority of the Haitian people? Whose priority is it? Who benefits from the outcomes of the research? Does the community benefit? If so, how? Does the researcher benefit? If so, how? Do both benefit? If so, how? Another quick story, I was in South Carolina some years ago and went down to one of the counties to do, actually we were going to write a grant. And I presented the grant. It was early days of CPPR, community-based participatory research. And at the end of the meeting, end of my presentation, one of the members of the community put his hand up and I looked at him and I said, yeah. And he said, what's in it for university? What is the university getting out of this? And I explained what the university was getting out of it. I explained what the community was going to get out of it, because we had thought through those things before we went down to that meeting. And at the end of the day, he said to me, I like your honesty. Because oftentimes people come and say, oh, the university is not benefiting anything. It's just a community. And we know it's not true. So it's important to be fair to the community and say what you're getting out of it. We're getting salaries. We're getting facilities and various resources paid for, and part of grants. We get transportation. There are lots of things that we get. So we have to balance that with what the community actually gets out of it. But we have to be fair. Education. What has the community identified as the educational needs of the community? What are the goals of the proposed action? What are appropriate strategies, approaches for addressing the problem? And those may be very specific to the community. What you do in West Louisville may be very different from what you might do in Haiti, or what you might do in Ghana, or what you may do in South Africa, what you may do in Belarus. And it's important to understand from a cultural perspective, from a local perspective, how information is spread, how people learn, what mechanisms people learn by, and what are the best ways of delivering the information that we have. What resources exist within the community and are available to address the problem? We often go into the community as public health professionals and we want to do a needs assessment. What about the asset assessment? What are we going to do that? We don't do that as often as we should, because it's important to recognize that communities have assets. And in knowing those assets, we can use those assets to the best advantage of the community. And the community learns that those assets are available to them in the long term. We don't necessarily have to bring things in from the outside all the time. We can rely on what's there. And these are human assets quite often. They're people who've been school teachers, they're people who've done work that we do, and yet if we don't ask about that, or we don't ask them to join us in our work, the community does not recognize them either. And then we are expected to continue to do this work forever and ever, where really what we should be doing is helping the community to build itself, community empowerment, individual empowerment. Service, what are the service needs identified by the community? What resources exist within the community and are available to address the problem, same as education? And what are the consequences of not addressing the problem? If we leave that problem unsolved, unaddressed, what are the consequences, short-term and long-term? Sometimes we have to help the community understand that even though they don't see it as a problem, it actually might well be. And it's up to us to find ways of helping the community come to the realization that when we've identified a problem, it's a problem that they may want to work towards solving. I've mentioned culture, I've mentioned countries, I've mentioned people. And it's important that when we do our work, we think of our work as being culturally appropriate. We must ensure that our actions incorporate different strategies that affect different levels of the problem that are being addressed on social, economic, and political level. We have to understand at what level people need problems to be addressed. Materials must reflect appropriate terms and understanding of the culture. Consider literacy, numeracy, and vocabulary. There are a lot more words in the English vocabulary than there are in some other languages. And words don't easily translate to other languages. So we have to be careful, and we have to be mindful of the fact that not all our words easily translate. So we have to understand how words are used and the vocabulary the community uses, which may not necessarily be ours. Organize activities based on community availability and the level of participation. We need to think in terms of what people's availability is for the programs that we do so that they can actually participate rather than us going and just delivering a service. Quite often we want to work from 9 to 5. Communities don't operate 9 to 5, unfortunately. So we have to be flexible. Incorporate different types of strategies: art, pictures, drama, song. These are all alternative ways of delivering messages, delivering information that the community may value. Use local talent, I talked about that already, as facilitators provide training and adopt principle of co-learning. That means I teach you, you teach you. Use clear and simple language to reach people at all educational levels. Specifically around research, in achieving research goals, one of the approaches I'm going to talk about a little bit is community-based participatory research. And that's a collaborative approach to research that equitably involves all partners in the research process from beginning to end, recognizing the unique strengths that each brings. And it begins with a research topic of importance to the community and has the aim of combining knowledge with action and achieving social change. It requires significant community involvement, which can lead to scientifically sound research. Research findings can be applied directly to develop interventions specific for the community. And CBPR has the potential to build trust and respect between communities and researchers. The number of principles associated specifically with community-based participatory research, although I'll say some of these principles are used across other community-based research, recognizes community as a unit of identity, builds on the strength and resources within the community, facilitates collaborative relationships and partnerships in all phases of the research, integrates knowledge action for mutual benefit, promotes co-learning and empowering process and addresses social inequalities, involves a cyclical and iterative process, addresses health from both positive and ecological perspectives, disseminates findings and knowledge gained to all partners, increasing ownership. There's another approach that's often used for communities, participatory action research, PAR, where community members and researchers collaborate to determine the problem to be researched. They collect data, they analyze the data together, they come to a conclusion, they determine the intervention, they implement the intervention, and they evaluate the intervention, all in that partnership. And based on this approach, definitions often shift. What we go in with may shift by the time we leave. Social action focuses on addressing communities' needs, and the outcome is empowerment in the community. Specifically in engaging underrepresented populations, there's a study done by Erbs et al. Reported in 2017, where they listened to the community about what they felt were concerns of underrepresented populations in research. And these were their findings. There was a lack of trust on lack of trust based on past experience with medical research. And we all know stories about that. Researchers were not forthcoming about their research process or research purposes. They did not provide evidence of progress throughout the study. There were concerns that they were being treated as guinea pigs. There was a lack of cultural competence and humility. And this is what one of the participants said in that study. I participated in research and I'd done it about 3 times. One was about body fat. They said I was obese. How dare they? And this came out of the research done by this group. So it's important that as we work with communities and as we understand what their needs are, that we are careful also about how we say the things that we want to say. We also need to go back and report our findings. This was us reporting back in Ghana after we had completed the study of the effects of gold mining on the residents of Aniem and Yoruba-Chieftain. You want to be updated on their progress, on what they have learned. They need to show you proof that they are making progress. So education and service. Create an implementation plan. Involve the community in doing that through community forums, ad hoc committees, working groups, community advisory groups, And communities need to identify priorities. You could use a systematic process for doing that, and a nominal group process is one of them, where it involves problem identification, solution generation, and decision making across the community involving multiple stakeholders. Identify and select those priorities based on importance to the community and changeability. We want to make sure that whatever we do results in a change for the community. So if we tackle something that's not really changeable, it will definitely lose credibility, but it certainly is not a good use of our meager resources, both ours and resources of the community. We want to make sure that we're building skills and self-efficacy, identify the actions to be taken, identify steps to achieve the goals of that action, and take small steps in successive increments. Ensure feedback, reinforcement, and appropriate procedures to increase learning. And these are basic strategies for increasing skills and self-efficacy. We go in oftentimes with a lot of information. We expect people to do a lot of things in a very short space of time, and we don't provide enough time for feedback and skills building. That's critical for learning and for long-term learning. So we'll talk a little bit now about strengthening that partnership. So we've come from entering the community, we've built a relationship, we've built trust in that relationship. Now I want to strengthen that partnership for sustainability. While we do this work, we want to make sure that we're balancing process and tasks. We go in very task-oriented, we have dates that we need to accomplish something, and we want it done. Unfortunately, the community does not like that very much. They want us to be able to balance, well, how do you do this, and process for doing it, with actually achieving the task. So we don't go so quickly that people can't keep up with us. We pay attention to the group itself and the infrastructure, the issues around building that infrastructure, and particularly at the beginning, when it's quite difficult to build trust among large groups of people. It's easy to build trust against one or two people, but as a group gets larger, it's important that we recognize that other people have to be drawn into that circle. So building trust over a large group is important, so we have to pay attention to that structure and the individuals themselves. Build a solid foundation to allow the partnership to grow. It takes time, a lot of time. Establish a project manager position in the community. Often that helps because then a person becomes a bridge between yourself, if it's a university, or the health department, and the community. Okay? And that person preferably should come from the community because they can be that liaison, they can be that ear in the community for the project. Conduct an annual review of goals and objectives. What have we achieved? What haven't we achieved? What were the barriers? What were the successes? What were the reasons why we were successful? What were the reasons why we failed? Build and establish activities. And when there's conflict, let's always assume the best in people. Let's take time to resolve the conflict. Let's ensure clear communication about the conflict and about the ways to resolve it. And let's negotiate a solution which is a win-win for everybody. In strengthening the partnership, we need to plan for financial sustainability. How is this partnership, how is this work going to be sustained beyond that grant, beyond that seed money? What are we going to do? How are we going to figure that out? We'll work with the community. We talked earlier on about assets within the community. Building on the assets of the community is the best way to ensure sustainability. Build capacity, groom leaders, create volunteers, develop trainers and advocates. But also celebrate the work, celebrate the partnership. When goals are achieved, birthdays and anniversaries, end of a project, when there's success. There are lots of opportunities to blow your horn, to talk about what the community has achieved, to show appreciation for those who have participated. We need to be flexible. I think a lot of things I've said probably allude to that, but we need to be very flexible when we work with communities. Our timeline is not necessarily the community's timeline, and we have to be flexible. We have to allow the community to come along with us, and that takes time. Make evaluating your partnership process and outcomes a priority. You start at the beginning thinking about what it is you want to achieve, and you monitor your achievements throughout. Learn from the mistakes and successes. Did it eventually have the expected impact or the results on the community health goals, on the problem being addressed, on the policy? Did it? Did it not? Did the partnership result in the benefits for the community? Was the partnership able to secure funding for ongoing activities? Because if it can't sustain itself beyond the money that we bring in on a grant, then it probably is not going to do the community as much good as we would have liked it to. The goals may have been partly achieved, may not have been achieved at all. So in sustaining that partnership, it means that the goals that were set at the beginning are much more likely to be achieved. So the benefits of community partnership include a focus on social justice. Community wisdom and science work in tandem to ensure a more balanced set of political, social, economic, and cultural priorities, resulting in shared resources and shared power, thus leading to equity and social justice. It helps to shape research and services that are culturally acceptable and more closely meet specific needs. It builds trust, increases communication, and creates an openness for engaging in research, education, and service activities. Residents feel involved with activities and decisions, and the word will spread, increasing participation. The more we involve community, the more community becomes involved. It connects people and resources, increases social capital, develops new leaders, creates an opportunity for critical reflection, for co-learning, and for capacity building. It results in actions that improve communities. So in fostering a lasting relationship, in sustaining the relationship, we need to nurture that relationship. We need to nurture the commitment through face-to-face and regular contact. It's not sufficient for us to go into a community for even 2 years, 1 year, 2 years, and leave and they never hear from you again for another year. As soon as we walk away, they forget about us. So if we want to build that relationship over time and have a lasting relationship with the community, then we have to find ways of continually engaging with that community. It doesn't always have to be doing a research project. It could be just visiting the community. It could be inviting the community back out to where you are and sharing a social event. Awareness of culture and diversity and its many perspectives is essential in planning, designing, and implementing approaches. Diversity may be related to economic, educational, sexual identity, mobility, literacy, personal interests. But that awareness of that culture and its diversity and its perspectives, and incorporating them in the planning and implementation, ensures that we can build a relationship of trust, and it's much more likely to last as long as we'd like it to. Identify and mobilize community assets and strengths, as we talked about earlier, and develop community capacity and resources. Release control to the community. Let them take over the lead. And be flexible to meet its changing needs. Identify and support developing relationships outside the work. This was pictures from my Haiti project, where over about 5 years we developed the idea of the initiative, and we went down to implement. It was the Cervical Cancer Prevention Initiative, using the working with Capricare, which is the organization that in south of Haiti, Pomfret. And what we did, in addition to the training of the physicians, the local physicians to do the work, we provided resources for the community, so we'll contain a lot of resources. We helped them develop materials and put together materials. We worked with them to develop educational outreach programs, and we trained them in these collection methods, and also ensuring that they collect data over time on the work that we're doing. And that's a physician, local physician, being trained in how to do the investigation. So partnerships, stakeholder collaboration, reciprocity, sustainability. There's burnout. And we have to be aware of that. And we protect ourselves from burnout by sharing our time, our talents, but our social lives and ourselves with the community that we work with. I thank you.
Questions for Dr. Harris? Turn some lights on here, please.
How many of you worked in communities? Yeah. Can you give us a...
I work in my community, so I
Which
really,
community is that? Can you define it?
Muslim community. Yeah, so I really see how you go step by step. That's how it really works. Yeah, you have to introduce yourself. Even in my community, when you go in a new group, so you really did very good in step by step. Honestly, it's very good.
Yes.
You talked about ideally, if you go in and say you do a research project or something, you get some funding to do a research project. Ideally, you don't want it to just go for 2 years and then when the grant is over, then it's like moving over there or something. So
Right.
what are some strategies then to kind of make some kind of project self-sustaining?
Okay, CBPR is probably, community-based participatory research is probably what we have the best model for that. And essentially, the best approach for CBPR is the community comes to us and says to us, you know, we see a problem in this community. We see that there, for example, there's blight. There are lots of boarded up houses, there are people living in those houses, there are land that's not been, there are no gardens, you know. And then you say, well, how can we help you? How much do you know about this problem? And the problem is not well known. So the research becomes us as the university, for instance, doing that research. How extensive is it? What is the problem? Who is most affected by the problem? And once we've done that research goes back to the community, and they will use that data then to think in terms of strategies. The CBPR is really about an action in the end. And that's where that work is continued. And as the work continues, you can come back and do another study. There's something else that comes up. Because communities are not static. Something else comes up. And we don't know anything about that either. So now, there we go. We can do that research. And we can do that research. And now it's about roads. It's about access. Or it's about traffic that runs through the community. Maybe we can't do that ourselves. Maybe engineering can, so we pull in engineering, and they can come in. So that's how you sustain that over time. But if we go into the research project that's not of their making, or not something that they're interested in, it's very difficult to sustain it over time. Unless we can be flexible at the end of that work, say, okay, now we've done that work, what would you like us to do for you? And then you can build that relationship up and do something different. But research just for research and research and research is not really sustainable in communities anymore. It used to be, but communities don't like it. They feel that they're guinea pigs. We're just going in to benefit ourselves. We're going to write the next paper. We're going in to get tenure. We're getting promotion. And we really don't care about them because it's not about them. It's all about us. And that's, you know, going back to the comment I made earlier, that who is benefiting. CBPR, community participatory action research, for the voice, qualitative research essentially allows the community to be active participants in that research, and therefore are more vested in it, and therefore can see what the problems are, they identify with work, and they are likely to move the agenda forward. By ourselves, we don't move the agenda forward unless it's of interest to the community. Any? Yes.
Can you comment on language barriers and the best way to overcome those? Do you need to have personnel inside
Yes.
your own group who are the main translators, or do you rely on translators on the other end, or how should that work out?
I think you can have both, but certainly not just within your group. I think it's helpful to have translators within your group because they can hear what's being said as well. And they hear both sides. Because we know of situations where the translation is not necessarily the translated version of what you said. So having somebody within your group is helpful. But it's more important to have somebody from the community who does that translation. Because they understand the culture, they understand the language. I mentioned earlier on that words are not always translatable. And so we might have a word and think that we can say it directly in another language. Even if it exists in a language, we don't want to say it like that. It has to be said in a more nuanced way oftentimes. And these are, when it comes to sensitive topics, we talk about sensitive topics, oftentimes these are very nuanced conversations within the community. I know we tend to be very bold when we talk, but communities don't necessarily appreciate that. We don't build trust by being bold about something. And I'm sure you can identify with that in the Muslim community. But other communities as well, not necessarily just Muslim communities, they don't want things being said directly. They prefer a more nuanced way. And quite often, we don't, even though we know the language, we don't often understand the nuances in translating that information to the community. So having somebody from the community who understands what we're doing and is willing to be an honest broker is probably the best way to approach it.
How did things work when you were in Haiti? Did you have persons?
I find Haiti very difficult, actually, to be honest, because of the language. We do have translators, but Haiti is unique in that it doesn't only have French, which nobody speaks. It has a local language that none of us speak. So you're sort of trying to work across a little bit of French that you have, which only the educated and elite speak. And down in Fonfred, very few of the communities speak French. So they may understand a few words, you may be able to say a few phrases, but in general they don't really understand what we're saying in French. So we've had to work with Capricare, which is a community-based organization, and they provide us 3 translators, which makes it very awkward, and a lot of us are sitting around a lot of the time waiting for a translator to be able to do anything. So that's one of the challenges when you're doing this work in communities. If you don't have enough people who speak both languages, you have to just wait your turn, as it were. But if you've built your program well, hopefully they've identified enough people who speak the language. But in Haiti, very few people speak English. Very few people speak English. Well, fewer speak English than speak French, but very few people speak French as well. So it is a bit of a challenge, I would say. And that's probably true of other countries as well across the world. Good.
Other questions?
Yeah.
Thank you very much. And please do complete the forms you have in front of you and hand those in to the secretary. We're here before you leave. Thank you.
Chandra, you still there? Hello? Are you
Yes, I'm still here.
Okay.
Yes, I'm here.
Did you have a question?
No, I was just listening along. I don't have any questions as of right now.
Okay, good. I think we're done at this end.
Okay. Well, thank you. That was a great training. I look forward to getting the audio and the visual for the presentation.
Okay, thanks for joining us.
Okay, thank you. Bye-bye.
Bye-bye.
Thank you.
Okay, thank you. Thank you very much. Thanks for coming.
Thank you for coming. If you can please complete the evaluation form, that would be amazing.
Thank you all for coming.